So with the learning process, we often think of visual, auditory, and kinesthetic process of learning. As for me, as a therapist, I'm usually a visual learner. So I use a lot of guided imagery, demonstration, copying of notes, highlighting key ideas and notes, flashcards, color coding, diagrams, charts, graphs, photos, movies, mind maps, and acronyms. So for me as a visual learner, I'm one of the type that wasn't able to do like online courses because I need to hear and see what I'm learning. So it's really important to sort of understand the type of learning process that fits for you as a beginning therapist. And so we're going to move on to global linear thinking. So this is where I want you to sort of think about where you fit in. So how do you process information presented to you? Who in your life do you believe processes information on the other end of the scale from you? How do you adjust your communication when speaking with a person who processes it differently than you? How do you feel that you learn best? So it's really important to ask yourself these questions when you're learning and you're growing as a therapist. So we're going to move on to the next slide. So what type of learner are you? Visual, auditory, kinesthetic, mixture, two or more of any of the above or other. So that, sort of gives you an understanding about the type of learning that fits you. And as I said previously, I'm a visual learner, so I need to see and hear things in order for me to process in a way that helps me to understand. So we're going to go into the integrated development model. With this, what this means is that counselors develop in a step-by-step approach. Counselors are seen to move through 3 levels of development in relatively orderly fashion relevant to professional activities. A model allows for brief regressions when counselors are faced with new tasks. People are continuously growing, and growth is not linear but sporadic. Growth can be affected by changes such as caseload, treatment settings, supervisory relationship, and the population that is being served. There are different levels of counselor development. There's beginning, intermediate, and advanced. Overriding structures means self and other awareness, motivation, and autonomy. It's also important to know the 8 growth areas as a beginning therapist, but intervention skills, competence, assessment techniques, interpersonal assessment, client consultation, individual differences, theoretical orientation, treatment plans and goals, and professional ethics. Also with going back to the levels of counselor development, level 1, counselors are full of trust and hope. Level 2 is often the confusion stage, striving for independence, less intimidative, sometimes frozen attitudes of ambivalence and instability. Level 3, calm after the storm, able to concentrate and demonstrate development. Learning is a lifelong process. That's one of the things that I talk about as being a mental and chemical health therapist, is that for me, I just continuously learn. I don't, pretend or act like I know everything. I'm always open to learning new things. So it's really important when you go into this field to understand that. We're going to go into microcounseling skills. So microcounseling skills was developed by Ellen E. Ivy out of Massachusetts. Ellen is co-author and author of more than 40 books and 200 articles and chapters, translated into 18 languages. He is the originator of the micro skills approach. So micro-counseling skills, intentional interviewing and counseling, facilitating client development in a multicultural society. Essentials of Intentional Interviewing, Counseling in a Multicultural World. It's really important if you get an opportunity to take a look at these books that will help you to sort of think about your skills as a counselor. Now, microcounseling is an analysis of counseling skills that looks carefully and in a great detail at the elements of the counseling relationship. Regardless of the aims and methods of a counseling relationship, understanding its micro-elements helps counselors improve their counseling effectiveness. So when we talk about knowledge, we talk about theories and research and evidence-based literature, approaches to counseling that are person-centered and have demonstrated effectiveness with individuals with substance use orders. There's definitions of warmth, respect, genuineness, concreteness, and empathy. Understanding the role of the counselor. Transference and countertransference are really important when working with individuals with mental and chemical health issues. One of the things that I was taught as a beginning therapist is to remember to take care of my own stuff before I start to work with other people. So I'm talking about like personal issues. Often if you don't take care of those issues, your issues will intertwine with the client, and sometimes we do more than what we should. So it's really important to take a look at that stuff. So the skills that we need to learn too is active listening, including paraphrasing, reflecting, and summarizing, conveying warmth and respect to the client, demonstrating empathetic understanding, using power and authority in the support of treatment goals. So one of the things that I remind people too is that it's okay to be compassionate with your client, but when you become too compassionate with the client, that's where we tend to work much more harder than the client should. Our attitude towards the clients that we work with is that we need to respect that client. We need to understand the importance of cooperation and collaboration with the client, and that goes back to what I was talking about earlier, is having compassion for the client. We need to cooperate and collaborate with them, but we also need to remind them that they do have the ability to sort of figure out things that they need in order to recover or go into recovery from alcohol and drugs or even mental health issues. So these are open-close questions. So it's really important to understand this, as Ellen Ivy says. So when we talk about active listening, we talk about body language. We need to pay attention to how our client is sitting, how the client's reacting when we talk with them. It's really important to have eye contact, but we also need to understand too, with working with Native American people, often Native American people do not make eye contact. And we need to know that because in the Native American culture, we don't make eye contact because it's a sign of respect and attention. We need to have space, distance and position and orientation when working with the client, and we need to be careful in regards to touching the client. Now, meaning like we could, put our hand on their hand or put our hand on their shoulder, but we need to ask permission to do that because it's really important, because one of the things that I've learned as a therapist is that often individuals who have been sexually abused often don't like to be touched. And so when we touch them without permission, we may trigger some of the issues that they may be going through. With verbal, we need to encourage having them verbalize their needs. It's important to ask questions because we need to understand what they need. It's important to also restate and paraphrase what the client says. For instance, example, the client may say, "I need this." So then we need to paraphrase or restate that by saying, I hear this is what you need. And then follow with summarizing. Now, when we talk about client observation skills, we're going to talk a little bit about reflective listening. So 85% of communication is through nonverbal behavior. Now, verbal behavior means keywords, so it's learning to listen to those keywords that our clients are saying. Discrepancies in clients' communication is mixed messages, contradictions, conflicts. So it's really important to know these things when working with clients. Now we're going to go on to talking about reflective listening even more. Now, reflective listening is talking about encouraging and then paraphrasing and summarizing. These are the three key points when it comes to reflective listening. Now, in order to develop those skills, we must monitor the client's behavior for consistency with established treatment outcomes. Excuse me. It's important to reframe and redirect negative behaviors, teaching conflict resolution, teaching decision-making and problem-solving skills, recognizing and addressing underlying client issues that may interfere with the treatment progress. We need to engage clients to discover and use personal strengths and resources to reach their goals. Now we're going to talk about reflective feelings. Reflecting feelings means the client's feelings either stated or implied as expressed by the counselor. Feelings of clients can be nonverbal or verbal. So a lot of times, it's really important to sort of focus on how the client's sitting, how the client's moving in the chair, or, face expression. Those are really important when working with clients because often that sends us a signal that maybe they're uncomfortable, it's something they don't want to talk about. And often sometimes our clients don't know what they want to talk about. And other times they will let you know what they don't want to talk about. Reflective meaning, finding the deeply held thoughts and feelings underlying life experience. Paraphrase is to thoughts as reflection is to feelings. It breaks down complex behaviors into parts. Then we're going to talk about empathy, understanding what the client is experiencing and putting oneself in a client's place. Now, that doesn't mean that we take on what the client is experiencing, but sort of helping us to understand what they're feeling. It's really important that we meet the client where they're at. And the functions of empathy, it builds a firmer relationship with the client. It enables counselors to better understand clients' behavior. The common problems with conveying empathy is language and cultural differences between client and counselor. And we'll talk a little bit more about that in the upcoming slides in regards to cultural differences. So here's another question for you to think about. Which of the micro skills has is the most challenging for you? Attending behavior, open versus closed questions, reflective listening, or empathy? So now we're going to go into counseling perspective theory. And I really have to apologize that I'm kind of sort of flying through these slides, but like I said, there's a lot of information that is being presented today. And so I'm sure that you all will get a copy of the PowerPoint presentation. So now we're going to go into psychoanalytical perspective. It consists largely of using methods to bring out the unconscious, working through past transference relationship, focused on childhood experience, and training is required beyond the scope of most counselors. An advanced degree in psychology or psychiatry is necessary. So for me, I began as a mental health therapist. I've always worked in the Native American communities, and one of the things that I know that really impacts the Native American community is, and then along with other communities, is that we have a lot of drugs and alcohol that impacts our community, and I want to talk a little bit about that in the future slides, but we're going to just sort of go over some theories now. So when we talk about psychoanalytical perspective, we're talking a little bit about Sigmund Freud. So with his theory, we're talking about the id and the superego. They're always constantly in conflict with each other, and the ego tries to resolve the issue. If this conflict is not resolved, we often tend to use defense mechanisms to reduce our anxieties. Psychoanalysts attempt to help patients resolve their inner conflicts. And then we're going to talk a little bit about Erik Erikson. So with his theory, it's broadened the developmental perspective beyond early childhood, establishing balancing between ourselves and our social world. Crisis is often creates a turning point, and ego developing strengths and ways to deal with life tasks. And then we also have personality stages. I imagine through your education, you're learning a lot about these theories. So it's really important to know these theories and using these theories with different clients. And often one of the things that I've learned as a therapist and a chemical health therapist is that often theories are often used together when working with a client, and that's okay. And then finding the right theory to work with a client. And not all theories work with clients. So it's just finding that theory that helps you to be able to work with the client. We're going to talk a little bit about Carl Jung. His psychological aspect of personality development during midlife views humans positively, individuation, spiritual approach, meaning of life, constant development, growth, and moving toward a balanced and complete level of development. Here's the overall limitations of psychoanalytical perspective. It's a lack of ego strength, need for change, great responsibility placed on parenting with the mothers, the cost, contributions, conceptual framework for looking at behavior, past experiences may pertain to the current life, value the role of transference, overuses the ego defenses and can keep clients from functioning effectively, role of early child development. Psychoanalytical theory has been criticized in a way that it overemphasizes of the importance of sexuality and underemphasizes the role of social relationships. This theory is not scientific and can't be proved as it is circular. Psychoanalysis has been greatly contributory to psychology in that it has encouraged many modern theories to modify it for the better, using its basic principles, but eliminating its major flaws. So, as you know, I graduated from the Adler Graduate School in Richfield, Minnesota. And with Alfred Adler, I really enjoyed his theory. My issue with Alfred Adler was back when way back in the early 1930s, when he was popular. One of the things that I know of is that Alfred Adler didn't work with low-functioning families, but would work often with highly functional families. But the Adler perspective is his theory on the emphasis on the importance of feeling inferior. The inferiority complex is recognized as isolating an element, which plays a key role in personality development. Alfred Adler considered human beings as an individual, whole. Therefore, he called his psychology individual psychology. Adler was first emphasizing the importance of social element in readjustment process. of the individual. And so when I was in college, I did my thesis on and compared the Adlerian psychology and the medicine wheel. What I liked about it was that a lot of his theories lined up with the beliefs of the Native American culture. So let's talk about the limitations. It was difficult to validate the basic hypothesis. He detailed exploitation of early memories and dynamics within a family. So when we talk about that, he's talking a lot about early recollections, things that we were taught as children and how we take those into adulthood. His contributions was working out an action plan to make changes in life. People are social, goal-seeking decision makers. Understanding the unique world of an individual, sensitive to cultural and gender issues. Existential perspective. So when we talk about this theory, we talk about Viktor Frankl and Rollo May. So existential theory encourages patients to evaluate their values, beliefs, and situation, acknowledge their limitations, find meaning and purpose in their lives, develop more effective ways of communicating. Existential therapy can be highly effective for those who are struggling to make healthy life choices and to accept the consequences of these choices. This may include individuals struggling with addiction, anxiety, depression, and a wide range of psychological and behavioral issues. As with most forms of therapy, it's more beneficial for an individual who is willing to engage in honest self-evaluation. Individuals who are reluctant to search for meaning or who would prefer to receive immediate relief from the symptoms of their problems this may not be appropriate for existential therapy. The limitations, it lacks a statement of the principles and practices of psychotherapy, lacks rigorous methods, concepts are abstract, it's highly focused on the physiological assumption of self-determination. The contributions is the person is the central focus. It emphasis on human quality of the therapeutic relationship, individual freedom to redesign his or her life by choosing awareness. The next theory we're going to talk about is person-centered perspective. Carl Rogers. So when we talk about person-centered therapy or theory, it's a humanistic psychology and is a psychological perspective that emphasizes on the study of the whole person, not holism. Humanistic psychologists look at human behavior not only through the eyes of the observer, but through the eyes of the person who's doing the behaving. The humanistic psychologists believe that an individual's behavior is connected to his inner feelings and self-image. The humanistic perspective centers on the view that each person is unique and the individual has the free will to change at any time in his or her lives. The humanistic perspective suggests that we are each responsible for our own happiness and well-being as humans. So let's talk a little bit about the limitations. Therapists tend to be supportive without being challenging, which can often be an issue. There's limited techniques. Attending and reflecting are two of them. Two of those techniques. There's more emphasis on the attitudes of the counselor. All individuals may not have within them a growth potential or an ability to trust their own inner directions. The contributions is stated concepts as testable hypothesis and was submitted to research. And it's non-directed counseling. So we'll talk a little bit about the Gestalt perspective. It was developed and popularized by Gestalt therapy. So his name was Frederick S. Perls. His work emphasized on the subjective approach to therapy, nothing that many of us split off our experience, our thoughts, sensations, and emotions that are uncomfortable. One goal of his work was to move people into owning their experience and developing into a healthy, whole person. We'll go into the limitations. It de-emphasizes of the cognitions, the thinking. It's not good to use with clients who have, a big history of abuse. Could be physical, sexual, mental abuse. It's dangerous as a result of the therapist's power to manipulate the client through techniques. The contributions are action approach, pays attention to verbal and nonverbals, compassionate confrontation, perspective on growth and enhancement. Now, William Gasser, he was a developer of reality therapy and choice theory. His ideas, which focuses on personal choice, personal responsibility, and personal transformation, are considered controversial by mainstream psychiatrists who focus instead on classifying psychiatric syndromes as illnesses and who often prescribe psychomedications to treat mental disorders. Glasser was also notable for applying his theories to broader social issues such as education, management, and marriage. Glasser, he advocated for the consideration of mental health as a public health issue. Talk a little about it. The limitations, de-emphasizes on the counseling process, does not take into account the unconscious, vulnerable to the counselor who assumes the role of an expert in deciding for others. The contributions, short-term focus dealing with conscious behavior, contract approach, punishment and blaming is a basic reality. Psychosis can be related to unfulfilled needs. Behavior perspective, Arnold Lazarus. It was introduced in 1958. He introduced the terms behavior therapy and behavioral therapist. He later brought in the focus on behavioral treatment to incorporate cognitive and other aspects. Lazarus, he expanded the scope of CBT to include physical sensations, visual images, interpersonal relationships, and biological factors. The final product of Arnold Lazarus' approach to psychotherapy is called multimodal therapy and shares many of its assumptions and theorizing with Alice, rational emotive behavioral therapy. As always, we'll talk about the limitations and contributions. The limitations changes behaviors but not changes feelings, ignores the importance of relational factors, does not provide insight, treats symptoms rather than causes, involves control and manipulation by the therapist, contributions, cognitive factors and subjective reactions of people to the environment, ethical accountability. So we're going to talk about the cognitive behavior perspective, which includes Albert Ellis, Aaron Beck, and Donald Meikenbaum. You have to excuse me, I have a hard time pronouncing that last name. Cognitive behavioral therapy is one of the few forms of psychotherapy that has been scientifically tested and found to be effective in hundreds of clinical trials for many different disorders. Cognitive behavioral therapy is usually focused on the present, is time limited, and is orientated towards problem solving. Patients learn specific skills that they can use for the rest of their lives. These skills involve identifying distorted thinking, modifying beliefs, relating to others in different ways, and changing behaviors. Excuse me. And so one of the things that I found out with using cognitive behavioral therapy is that it has been tested and proven and researched that this type of therapy is also good to use when working with Native American people. So one of the things that I know of when working with Native American people is that often we have a very difficult time in identifying our feelings or even validating our feelings. So what I have learned to do is teaching the client how to validate their feeling. And often sometimes the client will get stuck in trying to figure out why they're feeling depressed or why they're feeling sad, why they're feeling lonely. So one of the methods that I use when working with clients is having them sort of identify what they're feeling, not to try to figure out why they're feeling that way, but to tell themselves, yes, I'm feeling this way, and then giving them a choice by saying, well, I'm feeling this way, I have a choice. I can stay depressed, I can stay sad, I can stay lonely. What can I do to help myself? Well, I could read, I can go for a walk, or I can journal, I can, and often what I know of in working with Native American people, that when we are doing something instead of talking face to face, it helps us to be able to think and say what we need to say instead of just doing one-on-one talk. So one of the methods that I use when working with clients is, with Native clients, is allowing them to color if they want. I color with them. Doing some art therapy with them is really important. Beading. Like I said, I found out with working with Native people that often sometimes it's not good to talk one-on-one, but allowing them to do something that makes them feel comfortable in revealing or getting information from them. So getting back to cognitive behavioral, the cognitive behavioral perspective, the limitations is it does not encourage clients to trust unfinished business. That sort of goes back to what I was saying earlier. When a client gets stuck, it's important to try to teach them how to get unstuck. That sort of goes back to what I was talking about earlier, because sometimes we focus way too much on trying to figure out why we're feeling this way, when it's really important to sort of figure out what can I do differently so that I don't get stuck here. There's personal warmth. Personal warmth is not essential. Effective therapy, we have to be aware of transference, less concern in unconscious factors and ego defenses. Can often, it's a confrontational therapy. There's advantages and disadvantages. The contributions, self-responsibility in maintaining self-destructive ideas and attitudes, emphasis on putting newly acquired insights into action, teaches clients to carry on their own therapy. And then that, sort of like what I was talking about earlier, is like teaching them to get unstuck. Now we're going to talk about the family system perspective. So when we talk about family system perspective, we have a lot of individuals who have really sort of has grown this type of theory that we talk about when we talk about family systems. And so with that, the causes of the problem understood by viewing the role of the family. Now, we know as Native people that we're very family-orientated, and so we sort of have to figure out individually what is our role in the family. Often, there's unresolved emotional fusion to one's family, emotionally detached therapist, teacher, model, coach, here and now interactions between family members, techniques, family mapping, enactments, and reframing, and the limitations, the client may be lost in a system and language, more research needed. Neither the individual nor the family are blamed for a particular dysfunction. The family is empowered. Understand the individual within a system, those contributions. Now, one of the things that I know that I really encourage when I work with families is sort of challenging them in regards to, as I know with working in the Native community, one of the things that we really suffer with is codependency. Now, so with codependency, it's helping that individual to understand, that our feelings are just as important as another family member. But often what happens is that we're more focused on trying to please the other family member and not please ourselves. And so we sort of put ourselves aside to focus more on the individual or individuals in the family, when we should really take the time to sort of look at ourselves. So the integrative perspective. So creating an integrative stance is truly a challenge. It does not simply mean picking bits and pieces from the theories in a random and fragmented manner. It is important to ask which theories provide a basis for understanding thoughts, feelings, and behavior. Must have an accurate, in-depth knowledge of each theory. You cannot integrate what you don't know. It is an art to when, where, and why to use a particular intervention. It's a long-term venture. Caution, do not harm. That's really true, but like I said earlier, what I've learned to do is to integrate different forms of theory in working with clients. And as I said before, learning those theories is really important, and that's how you find out which theory works well with clients. Here's, which of the theories are you most drawn to? So this really gives you an idea of the different types of theories and sort of discovering which theories work best for you or which works well with the clients. I use all different theories when working with clients. I don't use just one. Assessing readiness to change. So the stages of change were developed by the psychologists Prochaska and DiClemente in the 1980s in an effort to recapture the change process in cigarette smokers in treatment. It has been used to characterize changes in other addictive disorders, including alcoholism. So with that, they developed the cycle of change. So when we talk about the cycle of change, I'm sure a lot of you have seen this model. It's really important to sort of understand and know this model because often, we get stuck trying to figure out how to get the client to move to the next when we really need to understand what is preventing that client from moving to the next phase. So when we talk about this, we're not considering change when we're talking about the pre-contemplation stage, unaware of the problem. So when we're talking about the contemplation phase, we're talking about, yeah, but, so they're still trying to sort of figure out, should I go on to the next phase, which is the preparation, determined to change, developing the plan. Change getting started through the action phase. Maintenance change usually becomes normal after 1 or 2 years. and often, when we talk about relapse, we use the word oops or, backslide. For me, I don't like to use the word relapse when a client has a slip. Now, when I think about relapse, I think about the individual when they relapse and they continue to relapse and they stay there. Now, I like to use the word slip when an individual may, go out and, drink or smoke pot or whatever, and then they go back to, like, going back to a meeting or going back to the recovery program. So, because a lot of people who use that word relapse often feel shame for their mistakes. So I always like to encourage them to use that word slip when they only do it once. Self-disclosure and keeping clear boundaries. Now we're going to talk a little bit about what we can do as counselors. Self-disclosures and keeping boundaries. So when we talk about self-disclosure and keeping clear boundaries, it's about sharing personal, emotional information with the client. Self-disclosure on the part of the counselor requires careful consideration, consider alternatives. Client's needs always comes first. Do not harm. So it's important when you think about self-disclosure and keeping clear boundaries is ask yourself, what are you disclosing that is benefit to the client? As Native American people, we usually like to share stories through narrative. Often it's important to do that because it helps the Native client or the client you're working with to understand, understand where they're coming from, and that maybe you had family members that went through that, or you had gone through a situation as your client. But it's really important to keep really clear boundaries when you're working with them. Self-disclosure barriers. They can slow down or even stop the sharing process. Clients may lose confidence in a counselor. Clients may move away from self-focus and focus. That's really important because I have seen or heard clients say that their counselor revealed too much information about themselves with the client. They lost respect for the therapist or the counselor. Or the counselor paid too much attention to him or herself. And so the relationship between the counselor and client was ruined. So it's really important to, know your limitations. How often did informal discussion occur? 42% of all rated sessions, on an average, discussions occurred once or twice per session. 68% of counselors had informal discussions 3 or more times in at least one of their sessions. 20% of counselors initiated informal discussions in 75% or more of their sessions. So here's another question to ask yourself. How helpful do you think informal conversations are in therapeutic sessions? A little helpful, moderately helpful, or very helpful? I like the fact that, in between each of these, there is, questions to ask yourself as you begin to practice, or if you're practicing already. So now we're going to talk about cultural and ethnic issues. So when we talk about culture, it's a key element which enhances opportunity for change. What is culture? Culture is everything that people have, think, and do as members of a community or a society. The material objects or ideas, values, and attitudes, and behavioral patterns, a template that shapes behavior and consciousness within human society. dynamic, shared, and learned. Our culture is shaped by history, religion, ethnicity, race, geography, group membership, slash subculture. So when we talk about knowledge, information and resources regarding racial and ethnic groups, lifestyles, gender, and age, as well as relative needs of people with disabilities. It's a unique influence of client's culture, lifestyle, gender, and other relevant factors may have on behavior. The relationship between substance use and diverse cultures, values, and lifestyles. Assessment and intervention methods that are appropriate to culture and gender. Counseling methods relevant to the needs of culturally diverse groups and people. You know, when we talk about attitudes, the willingness to explore and identify one's own cultural values, acceptance of other cultural values as valid for other individuals, understand the importance of self-awareness in one's personal and professional and cultural life. So when we talk about this, we talk about that it's important to, when working with a Native person. I work in a community here in Minneapolis called Little Earth, which is a Native American community in Minneapolis. It's a huge community. One of the things, and I work currently there, I believe that there's over 50 to 100 different tribes that live in Little Earth. So one of the things that I know as a Native person and working with another Native person, it's really important to ask that individual, where are you from? Because that also breaks down a barrier, so that it allows the client to say, well, I'm from, example, from the Sistian-Wafton Oyate. Then I say, oh, okay, you're Dakota. Often when you do that with a client, it's really, it breaks down barriers, and it sort of opens up that open communication with them. The addressing model, what does it do? It gives us a framework for understanding the effects of diverse cultural influences on therapists and clients. Helps us recognize the areas where we identify with the dominant group versus various minority groups. Becomes more aware of how identification with dominant groups can limit knowledge and experience of groups we do not identify with. Why is this important? The knowledge of clients' identities gives us clues to how the client sees the world, what they value, how they may behave in certain situations, and how others treat them. The more we know, the closer to our hypothesis will be the client's realities, the greater our credibility, efficiency, and accuracy. So one of the things that, that I like to talk about too is that if we do not find out where this client's from or what tribe they're from, their cultural background, often we make assumptions, and those assumptions are always true. So one of the things I always say is when you make assumptions, often assumptions can get you into trouble. So it's really important, to learn where this person came from, what their tribe is like, what do they do, because I mainly work with individuals who identify as Ojibwe. I work with people who are Dakota and Lakota, so I know that in ceremony, things are done differently, and to be okay with that. Often, sometimes we get stuck believing in one way, and so that can also change the relationship with the client that you work with. So it's really important to be open to learn about different tribes or different ethnic groups, or races. So when we're talking about privilege versus oppression, we all have addressing areas of privilege and oppression. We tend to be more aware of areas of oppression. Privilege areas present a greater challenge for therapists. We need to consciously work to increase our awareness about our areas of privilege. And it's really difficult. So one of the things that I really struggle with, I mean, I also call myself an advocate also in regards to the other work that I do besides doing mental and chemical health. I really work a lot in regards to LGBTQ issues. You know, one of the things that I work towards is trying to change the way that I think so that I don't have that oppressed thinking. I like to talk a lot about historical trauma and how it's impacted the Native American community. I sort of want to give an example of like oppressed way of thinking is not being able to sort of change my thoughts that may be helpful. I have high regards to individuals who are able to advocate issues that really impact our community in regards to like racism, discrimination. That stuff makes me angry, but I don't focus on that. I'm more focused on helping the client heal. So instead of figuring out where do you fit in, how are you going to help this client? You know, increasing our awareness, investigate our own cultural heritage, pay attention to the influence of privilege on our understanding of cultural issues, and work with clients, educate ourselves through diverse sources of information, develop sustained diverse relationships. So one of the things that I always talk about too when we talking about this is I always think about we can't teach what we don't learn or what we don't know. So it's really important to know these things when working with people or working with communities or different ethnic groups. You know, learn from diverse groups. Don't not simply learn about diverse groups, learn from. So it's really important to know those differences. So this page is in memory of Dr. Dwayne Mackey, who I believe has done a lot of contributing work to this curriculum. So it's really important that this just be a part of this so that we keep him in our memories and his hard work in the communities. When we talk a little bit about Native Americans, there's 565 federally recognized American Indian tribes and Alaska Native groups in the U.S. There's more than 250 different languages. There's different cultures, traditions, histories, and identities of Native Americans. In 2010, the census, there was 5.2 million people identified as American Indian or Alaskan Native. Or in a combination with another race. It was up 4.1 million in 2000. Estimated IHS service populations, 2 million Native Americans. So I'm Dakota, and I'm from the Sisseton, Wahpeton, Oyate. So these are the different bands that are part of Dakota, Lakota, and the Nakota bands. You know, when we talk about land transfers, so this is a comparison of you know, the causes of behavioral health disparities amongst Native Americans. So there's high levels of violence and trauma exposure and traumatic loss within Native communities. There's past and current oppression, racism, and discrimination that Native Americans have to deal with. They're underfunded in regards to systems of care. In 2008, per capita, funding for Native American health care through IHS is 60% less than is spent on the average American. The U.S. government spends less per capita on health care for Native Americans than it does on Medicaid. Recipients, prisoners, veterans, or military personnel are impacted by this. Funding for behavioral health care through IHS is less than $30 per year spent per person served by the system, including hospitalization. One of the most fundamental challenges to reducing health disparities and improving behavioral health care and healing is disregard for effective Indigenous practice and service provision, policy, and funding. Traditional practices and ceremonies have been effective for generations. Federal policies have prohibited them, disregarded them, perpetrated questions about their credibility and validity, and resulted in their loss across generations in some communities. The positive health outcomes are linked to spiritual practices, and the most resilient youth are those who are culturally and spiritually grounded. Because of the issues of trust and power related to the U.S. maltreatment of American Indians and Alaskan Native populations, challenge to Western behavioral health system providers in their attempts to provide culturally competent care to American Indians or Alaskan Natives. The barriers to care is geographical remoteness, poverty, transportation, shortage of qualified treatment providers, concerns about privacy, quality of care, communication, and trust. As previously stated, I work in a Native American community where what I just went over, they're really impacted by that. But this community is in the heart of Minneapolis. It's an urban community. I always say that the urban community versus the reservation community is, they have the same issues. They still have the same impact of historical and intergenerational trauma, but we know now that with drugs, with prostitution, with sex trafficking, that kind of stuff is now taken into tribal lands, as before it wasn't. I work with different individuals in regards to Native people, where the Native person may have been born in a city and has never lived on a reservation, versus I've worked with individuals who have grown up on a reservation and then have moved to the urban area. So their ideas and their thinking is different, and having to be respectful about that, and understanding of where they're coming from. With Native Americans, it's really important to be aware of the following cultural values held by many Native Americans. Importance is placed on harmony with the environment, meaning that human beings are a part of the greater creation and are meant to be relatives with all of the natural world. Humans are no greater or lesser than other parts of the natural world. Each person is seen as part of a larger system, the natural world, the nation, the community, the extended family. The goal of the people is to be a good relative to all others, as opposed to just being a good individual. The emphasis is on the good of the group or the community. Elders are respected for their knowledge and wisdom. There is respect for those who have lived and experienced, and that they are valued even more in their elder years for what they can teach us. Children are the future. They are seen as sacred and are to be protected and supported. It is important to realize that there are cultural differences in how this support is shown and taught. Non-Native helpers may misinterpret tribal support, teaching, nurturing, and discipline methods if they differ from their own. As responders, we need to always be aware of our own values, beliefs, and cultural biases. Helping others is more important than helping oneself. Community approach to healing is emphasized in most cases. Prayers and traditions are important facets of life, are sacred and must be protected. It's important to remember that within any community, not everyone will subscribe to the same beliefs. There will be likely to be a great variation from traditional cultural spirituality to Christian belief systems, or to blend even both of them. I see that happening with Native people. It is also important to remember that many adults and elders were raised during a time when, or in locations where, traditional practices and ceremonies was against the law. So it's really important to know that stuff that has prevented sometimes are, allowing that space for our people to heal. One of the things I tell people too is it's really important to educate yourself in regards to historical and intergenerational trauma and how it's really impacted the Native community and the Native individual, our families. So it's really important to really sort of learn about the impact and how it's, how it has really affected how we help our Native people. It's really sort of just understanding them. And we talk about intervention with Native Americans. The development interventions must consider, a specific socio-political history, the continuing transfer of unresolved trauma and grief across generations, socioeconomic conditions, current and past experiences of racism and oppression. Although many think of, the Native American culture as a visible Native American culture, we think about foods, music and arts, dance and dress. Intervention with Native American people must be done with the context of culture. I work with several groups. I work with the elder group, and I also work with another group where the concept of having them come together and to sit and bead and talk with one another. Often when we do that, we create that space for them to talk about some of the most difficult things, or even inviting people to ask questions amongst the group, talking about, what can I do differently? How do you do this? How do you do that? So you're, what you're doing in that group facilitation is allowing them to connect, work with one another, come up with solutions, because it should not always be about us trying to teach them, but allowing them to teach themselves and to teach others how to work through a specific issue or whatever. Here are tips for the clinician. Be aware of the many ways of perceiving, understanding, and approaching health, wellness, and healing. Be careful not to misinterpret, stereotype, or otherwise mishandle encounters. Be aware that ethnicity is used to stereotype diversity and can lead to distrust. Assess the degree of altercation in the target group. Seek to become more culturally responsive. Take the risk to discover own biases and stereotypes. That's really important. As my bio states, I work also within the Two-Spirit Native LGBTQ community. One of the things that I talk about is when presenting about the issues that impacts the Two-Spirit Native LGBT community is that not all individuals or tribes accept the word Two-Spirit. Specifically the Navajo people. The Navajo people don't embrace the term Two-Spirit because to them that means a good spirit and a bad spirit. But here in the Midwest, we're really accepting of the term Two-Spirit. And the term Two-Spirit means being able to, that the individual has the spirit of both a male and a female. So that's just sort of an example of, learning and discovering about different cultures and how they perceive things, because we don't always perceive the same things. Tips to becoming culturally.
Lenny, are you still there? We've lost your audio. Hi, everybody. It appears that Lenny's phone got cut off, so he's going to be rejoining us in a moment through his phone. So just hang on. He's going to call right back in. Again, super sorry about our technical difficulties today. So hold on, and he'll rejoin us shortly.
Can you hear me now? Sorry about that, everyone. There was some technical difficulties, but we're almost to the end of the presentation. I don't know if you heard last cultural considerations perspective, but I'll go ahead and just share it again. Tips for becoming culturally responsive. The primary source of cultural information should be your client. Multicultural skills must be personalized. Learn from your mistakes. Learn to reframe problems. Recognize biases, cultural psychological problems as constructs. So with that, I really want to share with individuals that, no matter if you make a mistake, be okay with it, because we are not always, or do we not always have the right answers when we're working with people. So, knowing when you make a mistake and being okay with it is really important. Even, we may say the wrong thing to a client, and that may have not been our intention, but often our clients will take it a different way. So it's really important to be aware of all that. And, the most important piece to all of this is learning to develop a positive relationship with the client and to be aware of our own self, and so that our own stuff doesn't get intertwined with their stuff. Healthy boundaries is really important. I'm currently a consultant therapist for the Little Earth community, so I'm really aware of what I can and cannot do outside of the very limited hours that I work with the people. If I know that a client is struggling, I will also take the opportunity to maybe text them back and forth and be okay with that. But I also let clients know that sometimes I don't always answer my phone or send text messages during the weekend. So it's usually an agreement between I and the client in regards to how much that their needs need to be met or whatever. So just being really careful and just being really compassionate. I always say each client has a story, so that space to tell their story. So in some we talked about was counselor development, microcounseling skills, counseling theory, self-disclosure and keep clear boundaries, cultural and ethnic issues. I apologize for technical difficulties that we had in getting it in at the end of the PowerPoint presentation. If you have any questions or concerns, please, feel free to contact the moderator here or the person in charge and forward, any questions that you may have for me through email. But it's been a really pleasure today presenting. Thank you.
Thank you so much, Lenny. We are going to be closing the webinar shortly, and then you will be directed to the survey where you can rate how today's meeting went. Feel free to give us your feedback, give suggestions for future webinars you might like to see. We really, really appreciate your time and your patience today. I want to thank Lenny so much. This was not an easy day, but we did it. So really appreciate everyone's help. Thank you so much. Have a wonderful day. I'm going to end the meeting now. So take care, all of you, and we hope to see you at future webinars.